The journey to wealth is a long walk, and some people may walk quicker than others. But what good is sprinting to the finish line if you pass out when you cross it? This is Walk to Wealth with your host, John Mendez. Hey, welcome back to the Walk to Wealth podcast. If you're tuning in on YouTube or any of the podcast directories, make sure to do yourself one teeny tiny little favor and make sure to give us a follow, because I don't want you to miss out on any of the amazing guests that are coming on this year. Without further ado, we have back-to-back weeks of people that I met from the blocks. It's crazy all the different people that you'll come across from opportunities that you never know what'll come from, right? I signed up for the blocks. I was like, why not? Screw it. And not only did I get to connect with everyone on my season, but they also had a group with people from all the seasons prior and all the seasons after that we were all able to connect with. And so Monica was on season 18, and we'll get into that in a little bit. But Monica, really quick, before we dive into the conversation and go into everything, tell us your quick elevator pitch. For anyone who hasn't had the opportunity, the pleasure to get to know you, to get to meet you yet, tell us who you are and what you do.
Yeah, I mean, I'm super fun. That's all that matters. So I'm a family nurse practitioner, and I own a primary care office that is membership-based, not insurance-dependent, in the Central Texas area. I also recently published my first book and online course, though, to help other healthcare providers get out of the world of burnout, because our healthcare system is really broken in this country. And so I'm on a mission to single-handedly change it.
Yeah, it's amazing.
That's what I'm here for.
Yeah, I know a thing or two about the healthcare industry. I met someone from along the way. She pretty much talks about patient malpractice and how the number one leading cause of death, I think, or the number two leading cause of death is just like malpractice, like accidents, giving the wrong dosages, wrong, medication, things like that. And it's like, so she's on a mission as well to like change it from a different angle. But like, yeah, I learned a thing or two about her from about the healthcare industry, and we'll dive into that. But first, I like to start off all my interviews asking this one question. The show is called Walk to Wealth. And so to start off, how do you define wealth?
Oh, I'm probably not the average, or maybe I am. We're about to find out. I used to think wealth was all about dollar signs.
Yeah.
And I've quickly realized in my age, because I'm nearly twice the age of you, happy birthday, John, is that wealth is defined to me by having the life and living the life that I want to. I love to travel. I love to spend time with my family. And so I know I have to have money to do that, but I have to have the time to do that as well. And so my idea of wealth and success is really about being able to live my life how I want to, and leaving an impact that isn't necessarily a financial impact. Of course, I want my kids to, live their lives, but ultimately, when I leave my legacy on this country, on this world, I want it to be that I made a difference and I made people's lives better.
Amazing. I mean, you're the third person I interviewed today, and so far, no one has mentioned anything about money in a definition of wealth. And so that's why I love asking the questions, because it's so subjective, right? Depending on what stage of life you're in, right? Depending on what season of life you're in, depending on where you were brought up and where you come from. And there's so many different factors that kind of go into it. And so I love asking the question because it really is open-ended and can lead you into anywhere. And so you mentioned family, time, and how you use your time, right? Is what most important for you. So before we dive deeper into that, I'm curious, like, what was your upbringing like? Did you travel when you were younger? Did you have a big family atmosphere when you were younger? Take us back a little bit.
Yeah. So I was not on my first airplane till I was 20.
Wow.
And so, no, I did not travel much. I came from a lower income family. I have an older brother and a younger sister. So we were a family of 5. My upbringing was fine. I always had what I needed. I never had to worry that I wasn't gonna have enough food or that I wouldn't have shoes on my feet. So my parents did a great job in making sure that we at least had that sort of stability. But to say we were rich, no, not at all. My father passed away when I was 20. And so I've now spent more of my life without my father than with it. And he was my biggest cheerleader in life. It turns out, as much as I say I'm an acts of service person, I'm actually a words of affirmation person right after travel. That's my love language. And so when I lost him, that was a big loss of my cheerleader behind the scenes. But yeah, I mean, I can't say I had like this lavishly amazing upbringing, but I went to a smaller school. I had really great teachers that led me along the way.
Mm.
And yeah, so it was a fine upbringing, and it definitely led me to want more in life.
Yeah.
I would see these big houses and people going on airplanes, and I was like, oh, someday
Yeah.
I'll do that. But no, all of our travel as kids was all in the car. We drove to Florida more than once, just 18 hours in the minivan
Sheesh.
without an iPad.
Yeah.
Can you believe it? We had these things called Walkmans back then, but we were only allowed to have one set of batteries,
Yeah.
and there was no way it was lasting more than like an hour. And so,
Yeah.
we had to entertain ourselves in much different ways back then.
Yeah, I remember when I was younger, like counting exit signs and trying to play like exit sign alphabets and see like what street names and like, hey, oh, this is Albert Street, and then someone had to find like, oh, that's Barclay Ave, and there's so much little things I remember from back when I was younger that we used to do back in those days, man. But take us fast forward us. I like traveling myself, so I have a reason behind this. But take us to that first plane trip, because I know at least for me, my first trip was my sophomore year of college. I mean, sorry, of high school, and it was only because I was part of my local Boys and Girls Club. And through them, they had what's called a Keystone, which is like their high school, community or high school program, whatever. And Keystone was having a conference. And so my first trip was from CT to Chicago for my first flight ever. So I remember that flight like it was yesterday. I was sitting next to one of my childhood friends, and he wouldn't let me have the window seat for my first flight ever. And so I was a little annoyed the whole time back. But on the ride back home, I got to get the window seat, so that was cool. I got to see the plane take off and land and all that stuff. So I remember that flight like it was yesterday. But similar to you, I didn't really I didn't prior to that. Never went on the plane. All my trips were road trips, and my furthest trip, not including like some college visits, was probably maybe 3 hours to take the state over. So I didn't really travel much outside of CT. And so now to you, what was that first trip like? Do you have a story behind it? Like, what do you remember from that first trip?
Oh, it was frightening. I was flying solo, so I had no idea. I was just like trying to follow signs, make sure that I was in the right place. And then I got on the airplane and I listened to every single word of that safety briefing. I like stared at the flight attendant and was like, okay, I have to listen to what she's saying. I pulled out the things in the seat pocket and read every word. Like, what happens if this plane goes down? What do I do? It was also very exciting because I'd never been on an airplane before. I was actually flying from Ohio, where I grew up, to Dallas, Fort Worth. My college roommate's parents lived there. And so we were going to go visit them. But she was already there. So I was going to fly solo.
Yeah.
And it was exciting, but also I was terrified because I was just sitting in this seat, like all by myself. Like, how does the seatbelt work? Does this thing? Yeah. So it was a thing.
Yeah.
It was exciting, but
I bet. I remember I flew that trip to Chicago. It was maybe like 15 or 20 of us. Because everyone in the group went, the counselors went. But my first solo trip was when I got into entrepreneurship. I was a real estate agent at the time, and it was from JFK, New York, to Florida. I went to Orlando, if I'm not mistaken. That was my first ever trip. I just remember walking through the airport feeling like I conquered the world. Like, look at me, I'm young, traveling by myself, independent, flying around the country, for a business conference. I felt like I was on top of the world. But all right,
you're the real deal, then.
Yeah, I was the real deal, man. I just got my real estate license a couple months prior. I was ready to rock and roll. And okay, back to you. Okay, what was your thought process around that time period? So, young adult, probably just finished high school. Where you said your college roommate, you went to college. Where was your thought process there in terms of like what you wanted to do with yourself or what you envisioned for yourself at that specific time? Like, paint the picture for us.
Yeah, so I started college as a biomedical engineering pre-med major because I was going to be a doctor.
Yeah.
My freshman year, I went to a panel of med students where we could just ask them questions. And the first question they asked was, how many hours a day do you study? And the first guy said 8 hours. The second guy said 12. And the nice woman at the end said 14. And I stood up and walked out. I was like, there is no way. I do not have the personality to sit and focus on something for that long. And so I changed my major to nursing with the intent that I could still go to medical school if I wanted. And about that time on my first flight, I was in my junior year, and one of my professors came to me and said, you should be a nurse practitioner. And I literally laughed in her face. I was like, are you kidding me? First of all, I don't even know what a nurse practitioner is. Second of all, I've been in school for like 16 years at this point. I'm pretty done. I'm out. And then she said, well, someone will pay for it. And I was like, oh, well, maybe I should learn more about this. And so I did. And she encouraged me to go to graduate school. So I went to Wright State University in Dayton, Ohio for undergrad. And no one knows where that is. A few people have heard of it, but it's one of those, like, I have to explain where I went to school. And so I decided, you know what, if I'm going to go to grad school, I'm going to go somewhere where when I tell people where I went, they're going to be like, oh yeah, I know that place. So I applied to Johns Hopkins, Yale, and Duke, and went to the one that gave me the most money, which happened to be Duke. So then I hauled off to North Carolina and started the next world of my life of working full-time and going to school part-time. But was incredibly fortunate and graduated from Duke at the age of 25 with a master's degree and 0 student loans. So wow. It definitely worked out for me.
And that's amazing. Yeah. That one, kudos to you for figuring out how to get that done, because the amount of student loan debt in this country is astronomical, especially at such a prestigious university such as Duke.
Yeah.
I can only imagine what like tuition nowadays goes for, probably like $70,000 a year, some crazy number, if not more.
Yeah.
I'd be surprised if it's under.
Undergrad is $80,000 a year at Duke.
Wow.
And I'm like, there's no way I would pay for that. Like, if my kid wanted to go there and we had to pay for it, I'd be like, absolutely not. You will go to community college.
Yeah.
There's no way. Right.
It's
like
nuts.
And the thing is, like, my degree from Duke is great, right? It was a great experience. I learned from amazing physicians and nurses and all the people because I worked in the healthcare system there. But ultimately, at the end of the day, it's not what got me my jobs, right? It was me as a person that got me jobs as a nurse practitioner. And so, yeah, I struggle with these stupid, expensive schools. But I thankfully got mine for free.
Yeah,
so.
Well, that's amazing. Kudos to you for figuring it out. And anyone listening, right? There's money out there to be given. I think there's someone I was talking about, and fact check me on this for anyone listening, but pretty much how like a lot of scholarships, there isn't like any competition for it. There's like maybe a couple applicants because most of them just go unapplied or very little people apply to it. So a lot of places have money to give. You just got to do a little bit of due diligence and go out there and look, and you could find a lot of free money out there. So do your homework. If you do want to go to school, there's ways to go for free, not just by having a job and getting someone to pay for it. There's scholarships, there's grants, there's ways to get creative, work studies. So figure that out. But okay, so we got that little bit of a picture, right? Grew up family of 3, or family of 5. You got 3 siblings. You're the middle child, I'm assuming, right? Yeah, you're the middle child. And then you went into high school, thinking about nursing, got to college, graduated at 25. All right, where does the story go from here? Right, so you just graduated, got your master's degree, you're already in the workforce, and now you just graduated from Duke.
Yeah.
Where does it go from there?
I started my journey into being an insurance-based provider because that's what people do in this country. So I worked for an orthopedic surgeon. I worked for a family medicine practice. I did urgent care, eventually got into venous lymphatic medicine, moved a couple of states. I was in North Carolina, then I went to Alaska for a little while. Then I went to New Mexico. And I was in New Mexico for about 7 years. I met my now husband there. And then we were relocating to Texas about 6 years ago. And at this point, I'd been an NP for 10 years. I'd work at the insurance world. We were relocating for my husband's job and to get near family, all sorts of different reasons. And I was trying to figure out what I wanted to do with my life. Because being an entrepreneur, to be honest, I didn't even know what that word meant.
Mm-hmm.
I literally played tennis with a girl a year before I started my business, and she had just graduated from college. And I said, what did you get your degree in? And she said, entrepreneurial studies. And I said, what's that? I legit didn't even know what it was.
Yeah.
Because I had zero intention of ever owning my own practice, ever jumping into that world, because I didn't understand it. I didn't have that background. But it was actually a Facebook ad that led me to opening my own practice.
Wow.
It was clickbait that said, family practice physician takes home $400,000 a year and is home in time for dinner. And I was like, well, that's clearly a lie. That's not real life, because primary care is so hard. You have to see 30-ish patients a day. You're constantly doing paperwork. It's just this big disaster. So I clicked on the clickbait, and it was all about direct primary care and this membership style of medicine. I was like, maybe I could do this. So I did a ton of research, watched 42 podcasts, every YouTube video I could find, and learned about it. And then I went to my husband. My husband has an MBA. And I said, husband, I'm going to move to a new town where I don't know anybody. And I'm going to open a practice with a new model of healthcare that nobody understands so that I can take care of less patients, take better care of them, have more control of my time, and I'm going to make the same amount of money. Let's just say he was not on board. He was like, that's not real, Monica. You can't do that. Like that's absurd. So I did a little more Googling of like how to write a business plan because, ChatGPT was not a thing.
Yeah.
I wrote a business plan and laid it all out. But I really at that point wasn't building a business. I just wanted to give myself a job.
Yeah.
I wanted to give myself a job where I could do what I love to do, and that's take care of patients. So I moved to Texas. 3 weeks later, opened my practice. I knew 2 people in all of Central Texas when I opened my practice. And yeah, fast forward 6 years, and now I have 3 locations. I have 7 nurse practitioners that work for me, and we have about 2,200 patients that we take care of.
That is amazing. So really quick, I just want to extract some nuggets from what you were sharing, because you definitely mentioned some nuggets of wisdom in there that I want to make sure it doesn't go over the listener's head. The first one that comes to mind is I started my story very similar, a Facebook ad. It was an ad. It was like no credit needed, no income needed. You just got to be 18, start investing in real estate. And I was like, all righty. I'm about to be Mr. Real Estate Investor. So I clicked on the ad, ended up paying for a $500 course. It was on real estate wholesaling. And I went through the course and I was like, all righty, sheesh, this is great. For anyone who doesn't know, real estate wholesaling is pretty much like finding someone that wants to buy a house, finding someone who wants to sell a house, matchmaking. That's pretty much all you're doing. Typically, these houses are in awful condition or in awful situations like freaking divorces or about to be foreclosed on or freaking, and you pretty much get paid to matchmake. And it's all off market. And so one of the attorneys that I called up, because Connecticut's an attorney closing state, I called up an attorney like, hey, this is what I want to do in real estate. Are you familiar with this? Would you be, interested in being a partner or whatever? And this one guy, like, super teacher's pet. You could just tell. He's like, oh, you can't, blah, 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 blah. You can't do this, right? And technically, you can't transact in real estate unless you have a real estate license, unless you're an active real estate agent or broker of some sort, at least in CT. But the caveat is that's if you're transacting on market. Because wholesaling is primarily done off market, you never have to worry about that. I didn't know that at the time, of course, and I was like, alrighty, well, my life is pretty much, my dream is ruined. And then a little bit later, I ended up deciding, I met with somebody. He was like, oh, you should get a mentor. I asked him to be my mentor, and he kind of sparked that fire to get into real estate as an agent, to get my license. And so, but long story short, similar to you, I seen a very enticing advertisement on Facebook, right? And then clicked on it and spent some money, but yeah.
I mean, I think the lesson here is just surf the world of Facebook and your next business venture might be awaiting.
No, 1,000%. And the next big thing that I want you to mention that I got from you is that you've seen it, but you did your own due diligence, right? You did a lot of due diligence. And a lot of people, again, they would see the ad, they could see an ad or something that sounds too good to be true, and they fall just directly into it. Doing your own due diligence is extremely important. And like for me, like I look back and I paid that $500 again. At that time, I was a sophomore in college during the middle of a pandemic. And like, did I really have the $500? Yeah, I had college refund money that I didn't need for room and board. And so, I was like, screw it, put it in here, right? It's $500. That's like books or whatever. And so even though
one book probably.
Exactly, one book. Well, I wasn't in bioengineering, pre-medical scientific studies, so my textbooks are a lot smaller. But I was taking like basic math and basic English at that time, all the gen eds. But yeah, so the next thing I want to mention, all right, so you do your due diligence, and then the third thing is you took a shot, right? You've seen an idea, right? You didn't know if it was going to work, and you just trusted the process. And does it always work out? No, you could have failed horribly. And if you never tried, you would have never known. And I feel like at least
Yeah.
talking to people my age, so I try to tell them like, the more you fail, the sooner you find your answer, right? I heard this somewhere, right? If 9 out of 10 businesses fail, that just means you got to start 10 businesses, right?
True.
9 out of 10.
Yeah, you might want to try to figure out what the failures were so
Yeah,
you don't make the
that too.
same mistakes
Yeah.
over and over again. But yeah. Hmm.
1000%. And so it's like for me, like I tried wholesaling. I try to get into real estate. Well, I have this pod. I don't treat this podcast like a business, more of like a purpose project, a hobby that I just really love doing. But I guess you could count that as one if you wanted. I try to start a social media agency. I try to sell courses. Um, and now I'm at where I'm doing now with teaching AI. And so like I'm technically like I guess you could say like I'm business number 6 or whatever. But like man, it definitely takes a few at bats, sometimes a lot of at bats to before you end up stumbling into something. So more power to you for taking that shot and then figuring it out. So fast forward, you move to Texas, you relocate with your husband for work, you start this new practice, and you have two people that you know in the area. Now fast forward now, again you have 3 practices or 3 locations, 2,200 clients. Fast forward to life today. What is that like? Managing the business, managing the home, the personal life, and all the other stuff that you probably do outside of those two. Like, what's it all like now?
It's pretty phenomenal. I'm not going to lie, but it's because I have made a lot of decisions and set a lot of boundaries to protect myself. I was that girl who was balls to the wall. I'm going to grow this as big as I can, follow the American dream. I'm going to make this thing worth 7 figures. Yeah, turns out that's not my idea of success.
Mm.
I really had to do a lot of thinking and journaling and therapy to understand that I was chasing everyone else's definition of success, where I need more revenue this year than last year, and I need to have 5 locations, not just 3. But what I found is that was exhausting and it was killing me, like physically killing me. So I really pivoted, and it was after my visit to the blocks that I made this realization that that's not the life I want to lead, because every clinic that I open requires more and more of my time and more of me. And I'm not willing to give it up. And so that's when I pivoted and really was like, how can I make a bigger impact without losing my sanity? And so that's when I pivoted to writing a book and creating the online course so that other healthcare providers can open offices like mine and be successful. Because at this point, I mean, my clinic, honestly, it runs by itself. I have an amazing operations manager who keeps the place running all day long. I can leave for weeks at a time and they do fine. I'm still the face of the business. So I still do a lot of marketing, a lot of video, a lot of social media stuff. I still make the big decisions, but the day-to-day work, I am completely not involved in. I stepped out of patient care a year and a half ago to just be the CEO. And it was frightening, honestly, because I went to school for a long time to get this license to take care of people. And I was like, wait, can I still be happy and not do that? And what I realized is that my happiness is in relationships, not in patient care. Like, I love to take care of people and fix them, but it's ultimately the relationships that I loved about my job. And so now I just do that in a different capacity.
Yeah, that's amazing. You mentioned um, about setting boundaries, and I want to touch on that really quickly and really dive deeper into this. There's a quote that I say, and it's a little harsh, especially when you're getting treated poorly to hear, but you teach people how to treat you. And
Absolutely.
if people are treating you horribly, and then this is where it gets into tough love, it sucks to say, but it's because you taught them that's okay to treat you. So I
100%.
want to hear your perspective on like, how do you set healthy boundaries? But more importantly, how do you reinforce those boundaries? And then the third question, triple layer, I got to peel back the onion a little bit. How do you enforce those boundaries that knew the person that you once were? Most importantly. So sorry, triple layer question right there, but really wanted to like, how do you set healthy boundaries? How do you enforce them? And then how do you enforce them with people that know who you were prior to you setting them? Because I feel like that's where it could really get tricky and you can really get, taken back or drawn back sometimes. So I want to hear your thoughts.
Yeah. A lot of trial and error. So especially as a new entrepreneur, I wanted every patient. If you were breathing and you had a credit card, you were my patient, right? But then that led me to answering messages at 11 p.m. because I want to make sure they know that I'm here for them, right? Because I'm offering them a service, right? I'm their healthcare provider, and part of the deal is that they can text me at any time. And so I left a world where I was burnt out to now a new world where I was burnt out just by less people, because I was letting them completely take control, right? I had a patient who was like, oh, well, I can only be seen at 7 a.m. It's like, well, my office opens at 8:30, but sure, yeah, I'll come in early. And not once, but twice did I come in at 7 a.m. and she no-showed me, didn't show up. And so after lots of letting people walk all over me, because that's what I thought I needed to do in order to show people my value, I realized that setting boundaries does not make you unavailable or mean. It actually makes you available to others. And so I had to completely change the way I dealt with patients and understand my value and what my time meant. And so now we have very strict rules as far as when we take care of patients and when we don't. For example, we don't answer the phone after 9:30 p.m. because guess what? There's nothing I can do for you. The pharmacies are closed. Urgent cares are closed. If you really need healthcare advice after 9:30 p.m., your only option is the emergency room. I can't help you. So I'm not going to wake up at 2 a.m. for your phone call for me to say, go to the ER. We just set very clear boundaries with our patients of when we respond and when we don't respond. And also that your poor planning is not my emergency. Do not call me on Sunday afternoon at 2 p.m. because you need your medicine refilled. I'm sorry. We're not dealing with that. And so we set very clear boundaries and we have to enforce them. And part of this is I have 7 providers who are on call at different times. And so if one provider does it one way and answers ridiculous messages that shouldn't be answered, and then the next provider is on and they actually know how to keep their boundaries, then the patient's like, but wait, you did it last week, so why won't you do it this week? Which is exactly what you're talking about, where if you had met me 6 years ago, the word boundary did not exist in my vocabulary. I would do anything for anyone. And I've been that way my whole life because I'm an overachiever and a people pleaser to a fault. And it wasn't until I finally realized that making everyone love me is not my job. There's a really great quote that I love that is, someone else's opinion of you is none of your business. Like, I don't need to know what everyone thinks of me. I can't convince everyone that I'm awesome. And that's okay. It's okay that people don't like you. And so it is hard to make that transition from letting everyone walk all over you to setting boundaries. But I will tell you, it's not only setting boundaries, but also setting consequences if those boundaries are not upheld, and sticking to it and making it clear what those boundaries are and what those consequences are up front. The better you are at it, the more life you're going to have.
Yeah, I agree with
you. It was a long-winded answer.
No, I love it because I think it's something that definitely needs to be touched on a lot more, specifically for service-based entrepreneurs and business owners, or anyone in the service-based industry altogether. Because, if you're coming from a service-based job, you're probably taught the customer's right. And most of the times, if you're a human being that's ever had a service-based job, most of the time, they're not only are they wrong, but they're so wrong. It's like insane. And yet the customer is always right. And so when you get that ingrained in you, and then also add on to the fact that, who wants to, some people do, of course, but generally speaking, most people want to make others happy. Right? There's always exceptions, right? There's always going to be bad apples. But generally speaking, most people do want to see other people happy. And so it's like when other people aren't, right, and they're blaming us, it can sting a little bit. But I love that you mentioned, one, about how you were trying to please everyone. And a quote that I have for that is, that kind of goes alongside what you were saying, is a friend to everyone is an enemy to thyself. And so I love that 100%. Quote because you can't make everyone happy even if you tried. And people are just too different, right? We're all very similar, but we all have different beliefs or different ways of doing stuff. So some people like hot coffee, some people like ice mocha, right? There's always going to be something little that someone will not nitpick or bicker about, and you're never going to be able to please every single person. You're going to lose yourself in the process. And so I highly recommend that you don't try.
What if one tool was all you need to start your business and make your first 6 or 7 figures? See, I was never entrepreneurial growing up. And after starting my first business, I spent the first 2.5 years completely lost. Nothing worked for me until I found Kajabi. See, if you offer coaching, courses, if you have a private community, if you want to start a podcast, a newsletter, a blog, if you have a membership community, Kajabi has you covered. They have everything you need to start, scale, and sustain your business all in one. So I want to offer you a free strategy session where we'll talk about your business, your goals, and how Kajabi can help you. All you have to do is use the link in the description, and as an extra bonus, I'll get you a free 30-day trial to test out Kajabi. Normally, they only offer 2 weeks, so hurry up, click the link in the description. With that being said, let's get right back into this episode.
To do that. And then the second part that I want to mention that you touched on is having clear consequences, right? Sometimes you just got to show your teeth sometimes, and sometimes you got to bite, a little bit, because if not, people are just going to, again, they're going to try you and see how much they can get away with. And it's not something that's malicious, right? Sometimes, again, it's just like, hey, can you come in a little bit earlier today? Right? It's so subtle, but it's one of those things, you give a person an inch, they take a mile, right? And so it's like, it starts off like, hey, can you just come out a little bit earlier? Hey, can you come out a little bit later? Hey, and then next thing you know, you build these relationships with people. And a lot of times people are working with us because of us, right? Yeah, maybe the service we provide is good or better than other. But at the end of the day, as you mentioned, in the service-based industry, people do business with people they like, know, and trust. The service we provide, of course, we would like to provide it the best of the best, but most people can't tell the difference in what we do anyways. They're really working with us for us. And
right.
Again, over time, that can add up and turn into something where it's like, by the time you look up, next thing you know, no one respects you, your time, your energy, and what you have to offer. So I love that you really just dove deep into it. And so, all right, fast forward. I'm interested to hear about how you found out about the blocks. So we talked a little bit about on the pre-show call, but for anyone listening, again, the blocks, they take anywhere from 10 to 14,000 applicants per season. So just to get on, you're one of a very, very small select few, and they have a pretty extensive interview process to select people. And then on top of that, you got to pay to be on the show. So most people don't get to make it on. And so what was that process like for you getting on the blocks?
Yeah. So actually a friend of mine was on your season, but he came in to see me. He was a patient of ours and he had some carpal tunnel issue. And he was like, I need you to do something about this. I'm going on this TV show. And I was like, well, I can inject it, but what's this TV show you're talking about? And so he told me about it and I was like, okay, that sounds crazy, but I'll go watch it. And so at the time, I don't remember which season was out, but I went and watched the season while he was at taping. And I was like, man. And there was one of the episodes was on customer experience. And I took so much knowledge from that. I redid my entire onboarding process of our patients, created a whole new form. It was very changed so much. And that was just from watching a season. So then Derek came back and we went to lunch and he was like, Monica, you have to go on that show. And Derek has an MBA and he was like, I learned more in those 5 days about entrepreneurship and business than I did in 2 full years of MBA school. And I was like, okay, all right, well, I guess I'll apply. We'll see what happens. And so Derek actually sent an email to Cassie, one of the
managing persons.
Yeah. And was like, hey, this lady's going to apply. And so I applied and got through. And then he was on in March. And then I went to record in August. Yeah. So
wait, if he was on in March, that's when I went, late March. Yeah. So I think around that time of season 11 or 10 was out. Cause I remember around that time, I was trying to prep for I was at the blocks recording, trying to prep for the blocks offs. And so for anyone that doesn't know what we're talking about, at the competition reality show where we were on, each day they have an exercise and breakouts. And then if you win your breakout, you get to go on the main stage and compete again with all the winners from all the different breakouts. And that's what the blocks off was. So I was trying to prepare for those challenges by watching last season's episodes while I was mid recording whenever I had some free time. But it's
smart, man.
It's so tough. Like, those are long days from starting in the morning to breakfast to filming and learning, and those are some really long days. And then the last day was like an 24-hour freaking straight through, no breaks, party, celebration, competition, everything, which is a great time. Man. But all right, so I guess fast forward to right now. What is your vision of everything? Again, you mentioned you defined what success looks like for you after coming back from the blocks. You realize you don't need more practices and offices and be the multi-7-9 billion figure practice, right? And you're enjoying life. You're traveling. You get to live life on your terms and run your business on your terms with the boundaries that you set in place. You're going to do fun stuff like go to the blocks, still enjoy the whole entrepreneurship journey. What's kind of your vision with everything going now? Like, what are you cooking up? Where are you headed towards now with everything?
Yeah. So my business, my office grows on its own at this point. We do, of course, some marketing, but it's really word of mouth is how we get most of our patients. Mm-hmm. And so the plan is to fill those practices with, we probably will max out around 4,000 patients. So we're a little over the halfway mark. But I'm no longer like, I have to fill those right now. So we're on track where we should fill those by the end of 2029, just naturally. And so I'm waiting for the day when my office is on a wait list and somebody either has to die or leave our practice for you to be able to join it. That'll be like, you want to talk about success? That is like a business with a bow on the top, because now I don't have to market at all. Mm-hmm. Right. But the other side of it is what I find really fills up my cup is talking to other healthcare providers and helping them get out of this terrible broken system. Not only because it's better for them, but it's also better for our entire nation. Like, if I could put a stamp on my tombstone, it would say she made direct primary care as well known as Walmart. Like, that is what I want to happen. 10, 15 years from now, I want direct primary care to be the norm, not the exception, where it's like, wait, you don't have a direct primary care provider? Who are you? Like, what planet are you living on? Mm-hmm. And so by writing the book and doing the online course, I can get more healthcare providers into the space so that more people are talking about it and doing podcasts like this, because I'm sure there's somebody listening right now who's like, direct primary care? I don't even know what that is. Well, let me tell you, it's healthcare that doesn't suck, my friend. And so that's really where I see my trajectory. I love to do consulting with these healthcare providers who are like, how do I do this? I'm like, let me tell you, let me just fix this for you, because I don't want to be responsible for someone else's success. Could I franchise what I'm doing? Absolutely. But once again, that's my time. That's me. It's my sanity. And I have a 10-year-old. I have 8 more years with him before he goes to college. And I'm not willing to give up my time with him so that I can build something so that I have more money when he's gone. That doesn't do me any good. I also have a sugar daddy. So and by sugar daddy, I just mean an incredibly successful husband, who's also very supportive. So yeah, I just need the world to know what direct primary care is so that marketing isn't so hard for all of us. And so that we can really change the face of healthcare in this country. So we aren't a sick care focused system. We are an actual healthcare focused system.
Yeah, and I love that you brought that up, which leads perfectly into my next question, which I wanted to ask, because I know a lot of people are probably asking, what on earth is direct primary care? So break us down, like, and educate us really quickly. Like, what is that? What's the difference between direct primary care and the way our current system is for someone who doesn't know anything about healthcare? How would you break that down?
Yeah, so direct primary care is like Netflix for your doctor, or affordable concierge. So our cost is $79 to $99 a month, depending on your age. And it gives you unlimited access to the office. There's no office visit fee. There's no copays. It includes telehealth visits. It includes the ability to directly text your provider. So if you have pink eye or a rash, I don't need to touch you. Like, take a picture, send it to me, and let's handle this over the phone. We have same-day appointments, online scheduling, all sorts of things that we are just here to be an advocate for our patients. Our system is very broken and very difficult to navigate. Just like you don't expect me to know how to talk to teach AI or sell a house, I shouldn't expect people to know what to do in this healthcare system. It's so broken. So direct primary care is a really great option for individuals and families that have high deductible plans, because as of January 2026, you can use your HSA to pay for your membership due to the one big, beautiful bill that was part of it. We also work with a lot of people who have health shares, and then a lot of people who are uninsured. They don't have insurance. They can't afford it because it's stupid expensive. But we also work with a lot of local businesses that don't offer health insurance because it's really expensive and it doesn't cover crap, right? So unfortunately in this country, we forgot that health insurance is not supposed to cover your day-to-day stuff. It's supposed to be more like your car insurance, right? Your car insurance only pays when shit gets ugly, right? It doesn't pay for your tires and your oil change and your gas. It takes care of those big things. And so unfortunately, if you walk into a healthcare provider's office as an insurance-based customer, like you have a Blue Cross Blue Shield card or an Aetna card or a Cigna card, you're not the customer. Your insurance company is. And so that provider has to do what the insurance company says is okay, not what you and the provider want. And so much of our healthcare is focused on taking care of people after they're already sick instead of preventing it. We're all about throwing drugs at people instead of actually getting to the root cause of things. I'll tell you, if your primary care provider has not said the words sleep, stress, nutrition, or body movement to you, you're in the wrong place, because those are the 4 things that will keep you healthy and well. And if you don't talk about those things, you might as well just go try to find a magic Band-Aid, because you're going to get old and you're going to get decrepit real fast. Don't get me wrong. There's a time and a place for health insurance, right? If you need your appendix removed, God forbid you get cancer, you're probably going to need something to help you with that. But for all your day-to-day stuff, you need somebody who actually cares about you and is going to make it easy. So we just take the barriers out of healthcare. We make it accessible, affordable, personalized, and then people will actually get care. Even dudes. Yeah. Even dudes will show up.
Yeah. I mean, hey, that level of invincibility that I had back in high school has been wearing off very quickly. I found out I had scoliosis.
Wait till you get to 40.
I'm not looking forward to that at all. Found out I had scoliosis this year. Broke my first ever bone this year. I broke my thumb, which is a non-displacement fracture. Ooh. But my thumb still is stiff. Like I lost so much mobility, so I start PT in a couple of days to try and get that back. But yeah, I haven't been able to bend my thumb in like 2 months.
Thumbs are very important.
Very, yeah, and very annoying when they're not able to work properly, because like tying your shoelaces or texting or typing on a keyboard or it's a bunch.
Or buttoning your pants.
That buttoning my pants.
Who knew buttoning your pants was so hard without a thumb?
Yeah,
try it. There's gonna be somebody who listens to this and tonight tries to button their pants without a thumb. They're gonna know how hard it is.
Yeah, and so it's annoying. Then a couple of years back, I rolled my ankle like 3 times in the same year. So it's like, yeah, thank God I have insurance, because it definitely helped out. But also, this whole new model of, now that I'm starting to get more and more aware of like health, I'm the one, at the appointments by myself, and I'm now helping my grandparents with their appointments. So now I'm getting to see like firsthand like what this whole system is like. It's definitely very screwed, and like primary care or direct primary care is the format, right, that you're promoting, if I'm not mistaken, right?
Yep.
I definitely see a big like upside for it, because it's like it's so expensive for anything. I was looking at health insurance literally a couple of days ago. It's like at minimum $500 to like, and that's at the low end in Connecticut, to like $1,000 a month.
Well, and you likely have a high deductible with that, right? So you're paying $500 a month for your premium, but then you have to pay another $3,000 to $5,000 out of pocket before your insurance will cover anything except for an annual physical. So we have a contract with a local lab to get labs at about a 90% discounted rate. Wow. So my mother-in-law is on Medicare. She comes to me as a patient and I give her her annual labs, and annual labs should be more than just 4 labs. Like we do a pretty extensive set, right? So I give her this lab order and I say, go to the lab, but don't run it through your insurance. Tell them to client bill it, which means I get the bill as the provider. So she does. Of course, she doesn't tell them, and they run it through her insurance, and she gets a bill for over $1,500 for these labs that I ordered. So she brings me the bill and she's like, what do we do? So I call the lab and I say, listen, this was client billed. It was billed wrong. Can you reverse it and send me the bill? So they do. And my total, $57.
Wow.
It's mind-blowing to me how a small little tiny practice, can get a better deal than Medicare.
Yeah.
We wonder where all of our taxes are going. There you go. That's the answer. And this is just one example of the number of ways, right? So in your situation, right, you roll your ankle, you have to go to urgent care and pay that bill plus the x-ray bill and all the things that go along with it, right? Where our patients, I had a patient who fell while camping. She sends me a text. She's like, hey, I fell. It still hurts. What do we do? And I was like, well, you can go to urgent care or I can send you for an x-ray. I emailed her the order for her x-ray. She took it to the place, paid cash $50 for her x-ray. I pulled up the films on my screen 3 minutes later and said, oh yeah, you have a buckle fracture. It's completely stable. Don't need to do much. You need this splint. It was on Amazon for $12.99. She ordered the splint. I was like, you need to wear it 24/7. We need to repeat your x-rays in 4 weeks. I never touched that patient. I never talked to her on the phone. We did this all via text because she was at work.
Yeah.
And she was completely taken care of for less than $100.
Wow. That's,
yeah.
You have any locations opening in Connecticut anytime soon?
So there are actually offices like mine all across the country.
No way.
So if you Google direct primary care mapper, it will give you a map. There's around 3,000 offices like mine across the country. Now, of course, mine is the best, but we can only take care of patients in the state of Texas.
Yeah.
It's just rules across the line. But if you're anywhere in the US, there is likely a DPC practice somewhere near you. And if not, then go find a healthcare provider that you think should start one and send them my way. I will convince them.
It sounds amazing. So, Monica, we'll probably keep on going forever on this specific topic, but I appreciate you for enlightening us and bringing this to our attention, because again, it's something I never heard of before. So I appreciate you for that. And for anyone that either maybe needs some direct primary care health in Texas, or they need help finding one, or they're a practitioner and they need help restructuring their business model, where can we find you? Where can we connect with you, sir, for all things Monica?
Yeah, I mean, my name is pretty abnormal. McKitterick is not a common name. So if you just Google Monica McKitterick, you'll find me. That's my LinkedIn profile, because there's no other Monica McKittericks anywhere in this country. But Impact Family Wellness is my direct primary care office. So if you have questions about direct primary care, just go to Impact Family Wellness on all the social platforms. There is plenty of videos with my face all over it explaining what we do. If you're that healthcare provider looking for guidance, the dpcformula.com, also on all the social platforms, will get you to me. But ultimately, Monica at dpcformula.com. Just send me an email.
Amazing.
I'm here for it.
And now it's time for our famous 5 questions. Same 5 questions I ask every single guest that hops on. Rapid fire round. Question number 1. What is the most impactful lesson you learned in life?
Success is not what everyone else says it is. It's how you define it.
What is the most admirable trait a person can have?
Kindness.
If you had to change someone's life but only had one book, which would you recommend?
Girl, Wash Your Face.
What is the legacy that you're working on leaving behind?
I'm changing healthcare in the United States of America.
And for anyone that wants to embark on their walk to wealth, what is the first step you recommend they take?
Follow your passion. If you're passionate about it, it's not work, it's not sales, it's your passion. So find something you're passionate about and make that your all day, every day.
Amazing. Monica, thank you so much for your time, your wisdom, your energy. Thank you for celebrating my birthday with me the best way how.
Happy
podcasting.
Birthday!
I love, again, I told you before, I love having these conversations. So thank you so much for making another amazing episode with me. And for anyone tuning in, listening, thank you so much. And I'll see you in the next episode.
Thank you for tuning in to the Walk to Wealth podcast. There's an old African proverb that says, if you want to go fast, go alone. But if you want to go far, go together. So make sure to hit that subscribe or follow button so we can continue on our journey to wealth together. And again, I'm your host, John Mendez, and I'll see you on the next episode.